Hello, my name is Annalisa and I will be demonstrating how to scan a liver. So I'll be using a curvilinear probe and I will apply gel to the probe and apply it to my patient's body. And before I begin, I do a quick sweep prior to. We're just going to go left, then right, and we're just checking to see if anything pops out at us. Okay, and then we'll go trans from superior to inferior. Okay, great. And so before we begin, I start with sagittal images, and we are going to be going from midline to left. We'll be decreasing my depth, increasing my focus. I'm going to have my patient take a breath in and hold. And we are looking for the area of the caudate lobe right there. And that's where we will take our first image. And then we will go out every couple of centimeters. We have the aorta as one of our landmarks. And just continue sweeping out until we get to the end of the liver. We're just going every couple of centimeters until we're completely out of the liver. And then we will take our left hip and this is just so we can make sure that there isn't anything that's pedunculated. We adjust our settings to clear that up, and that looks nice. And now we're going to be going midline to the right. And then again, I begin at the area of the caudate lobe. Patient, take a breath in and hold. I'm going to adjust my TGCs a bit just to make sure that the liver looks even all around. And then we start from midline. We take it out to the IVC, drop my focus a bit, send it back to where it's clearer. Patient breathe. So as the lobe gets larger, I like to have my patient breathe so I'm not having them holding their breath the entire time I'm adjusting my settings. Okay, patient breath in and hold. Okay, and now one of the next landmarks is the main lobar fissure right there. And then we continue sweeping out until we're out of the right lobe of the liver. And the entire time we're trying to make sure that we keep that nice border there the entire time. And that's good. Breathe. And now we're going to be doing a kidney comparison. And we're going to be in the midclavicular line. Okay, patient breath in and hold. And we want to see this nice kidney here, fully elongated. And if we can, try to get that tip in there. So I just widen the screen to try to get that tip in there. And breathe. Lower my gain. So we take that. And now from this image, I'm able to get a measurement. I'm going to change my label to just make sure that it shows it as the right lobe. And then liver length. We use the calc package and we go from the tip right there down to the diaphragm. We're just going to trace this to find this longest. And that's good. Make sure not to include the diaphragm. And now we're going to go transverse. We're going to be going on the left side. So trans liver. left lobe, and we're going from superior to inferior. Okay, I'm going to have my patient take a breath in and hold and adjust my focus. And we're looking for no man's land. So patient, I'm actually going to have you breathe normally for right now, and then I'm going to have you take a half breath in and hold. So we're just going to adjust how deep our patient's breath is, just so that way we can optimize our image. So we're looking for no man's land, and we want the hepatics on the left side of the screen. That looks good. So we're going to go a little more superior to that. Patient, breathe. I'm going to have my patient catch their breath and then start again. There we go. So we want no man's land where there's no vasculature. That looks good. And then we have the hepatics closer to the left side of the screen. And then the portal. I'm going to decrease some depth here. And then ligamentum teres, which is this little triangular structure there, until we get down to the area of the pancreas. Perfect. And now we are going to do the lateral edge. We want to be at the area of the porta hepatis. Okay, patient, breath in and hold. That's beautiful. Okay, patient, breathe. And now we're going to be doing the right side. And we are also going to be going from superior to inferior. I'm going to increase my depth here since this is a larger lobe. Okay, patient, breath in and hold. Okay, decrease some of that depth. Find an area of no vasculature, so we go above those hepatics, and then we just keep sweeping down. We see the hepatics here, and then we find the portal. And we see the kidney coming in, and we see how the kidney is in a C shape. That's how we know that we are transverse. And we just keep following that down every couple of centimeters until we are fully out. Let's decrease some of that down. Perfect. Patient, you can breathe. And now we're going to be doing the main portal vein. I'm going to be applying some more gel. I'm going to be going to the intercostal spaces to the patient's right. I'm going to be decreasing that wide scan. Increase some depth. And at this time, I'm just going to continue having my patient breathe normally until I can find the structure. Turn on color. Increase my box. And that is beautiful. Now we want to find the CBT. We stay in that same area. We're just looking superior to that main portal vein. Try to find a different window. I'm gonna go actually and take take a more anterior approach and find that main portal vein again. Decrease some depth. I have my patient take a breath in and hold. Perfect. Decrease some of that color because it looks like it's bleeding onto there. And breathe. And we have the CBD right there. And we're going to enter it into the cal package. I'm going to go from anterior to posterior. That looks good. And then lastly, we have the hepatic veins with the IVC. So I'm going more midline. Oh, that looks gorgeous in grayscale right now. It's beautiful right now, but we want to fill on that right side. So for right now, we have the mid and the left. So we're just going to angle a little differently. Adjust our settings, increase our color gain a bit. Here we go. And now we have the right mid. We have branches of the left, and that concludes our demonstration.